Hello guys, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here. Today we will discuss about CO51 denial in medical billing. This denial is telling that non-covered services due to pre-existing condition. So if you are submitting any claim to insurance company will deny stating that CO51. At the time, what kind of pre-call analysis we would like to take on this scenario, and what kind of questions we should have to ask to the insurance representative over the phone call, and also what kind of final action we would like to take on this scenario we will discuss in this video now. Okay guys, before we are discussing about pre-call analysis, just we have to understand what is pre-existing condition. So generally a medical illness or injury that patient have before started a new health plan. So nothing but a medical condition before health insurance start into effect, the patient have that kind of medical illness is known as a pre-existing condition. Nothing but if you would like to take any policy, before buying a policy, you already have a that medical disease. At the time, it will be known as a pre-existing disease or pre-existing condition. So I given one point, any service related to this condition will be denied as a pre-existing condition. A waiting period is available here. For example, you have a diabetes. So here there is a there is a particular waiting period for that diabetes. For example, you have a high BP. At the time you have a some kind of waiting period for that high BP. For example, you have a some chronic diseases or some kidney failure diseases. For that particular kind of disease you have a particular kind of waiting period. So this will be depends on a that particular kind of disease or condition. So that is why it will be known as a pre-existing condition. So before you are taking a policy, you already have a some disease or you have a some kind of medical uh, illness that will be known as a existing disease or existing condition. Okay guys, here we will discuss about pre-call analysis for CO51 denial. Pre-call analysis means, by name we can understand that before calling to insurance we should have to do a basic analysis on a claim, so that we can understand what happened on a claim and why it is denied and what kind of information we should have to verify. And for example, you submitted claim to insurance, you don't have any claim status. At the time we should have to check the claim status in our respective clearing houses and respective practice management system, I mean softwares. And also if you have a access for portal, we should have to check the payer portal for a claim status. That is okay. And for this CO51 denial especially, we need to verify the nature of the service provided. So here nature of the service means we should have to understand what kind of service we build, and what kind of patient have a pre-existing before buying this policy. So there are some pre-existing diseases. For example, patient have some pre-existing diseases. So what kind of services we build right now? It is related to that particular disease or some other service. For example, patient have a diabetes and we build a claim to insurance related to some other surgery, not related to diabetes. At the time we have to understand that okay, we build to insurance not related to diabetes, some other services. Like that we need to verify the nature of the service whatever we provided. We means doctor whatever provided to the patient. Second point is we need to verify the patient medical history. That is also similar to first point approximately. Means we have to understand what kind of diagnosis patient has and what kind of services we build. So how we know that information means we should have to verify the patient medical record. If we are understanding how to read the medical record, then we can understand what kind of diagnosis is treated, so that what kind of diagnosis we build and the patient what kind of diagnosis he had, I mean he have before buying this policy. So for example, I already told that patient has a diabetes as a pre-existing condition. For example, here we build services, some other services, some other, for example there is some surgery happened because of some other reason. So at the time we build, for example, at the time we have to understand that okay, this is not related to the pre-existing disease. For example, we already build a claim to related to pre-existing disease, that is diabetes. So if we are understanding medical records also, the diagnosis also telling that it is related to diabetes. So in that way we need to verify the patient medical history. And the third point is carefully examine all relevant health policy documents to ensure the necessary information. That's approximately same. And fourth point is we need to verify the previous dose history and also other covered insurance details. For example, we are submitted claim to insurance and they are telling that it is a denied as an uncovered due to the pre-existing condition. At the time we have to verify previous dose. For example, we already got the payment, similar kind of uh, services. At the time we should have to prove that previously we got the payment, right? So now also we got the payment. How we know? By doing pre-call analysis you can understand. At the time you should have to call and you should have to probe this information that previously we got a payments for similar kind of diagnosis condition. Now also we got the now also we got the payments. So in that way you should have to do a pre-call analysis. And also, for example, previously we don't have any payments and this is the first time and insurance is denied stating that pre-existing condition. It is a denial is a true. If you are verifying medical records also, it is a found that we are billed related to, for example, diabetes. So previously we doesn't have any this kind of claims are billed and also not claims are paid. So at the time we have to understand that this is not covered. It is a denial is true. At the time we have to verify is there any other insurance. For example, insurance is denied stating that non covered, then it is a true denial. We, after verifying, we found that due to the pre-call analysis and we found that denial is a true, it is a non covered, and we billed first time and also we don't have any pre or post date of services, whatever services paid. At the time we have to understand that is there any other alternate insurance to bill this kind of non-covered services to be covered. So that is a alternate way, right? So if there any other insurance is available, okay, this insurance is denied stating that non-covered, then we should have to bill to some other insurance to be covered. So in that way the pre-call analysis is we should have to verify the other covered insurance details. Hello guys, now we will discuss about CO51 denial on call steps. For example, we submitted claim to insurance, they are telling that insurance is telling that CO51 denial. So at the time we have to understand that insurance is not covered this kind of services due to the pre-existing condition. At the time what kind of on call questions we need to ask to the insurance representative, we will discuss now. First, for example, you don't have any claim status in our respective PMS or clearing houses or any portal. We doesn't found any claim information. At the time, we should have to call to insurance and we should have to ask the basic question like, "Hi, this is Mike. I'm calling from provider's office checking on a claim status." So in that way, you have to start your conversation and after you started this conversation and the first question is, may I know the claim status please? You have to ask like this. At the time insurance representative will verify the provider information and also claims information. Provider information means insurance representative over the phone call, they will verify what is the provider NPI or tax ID and also what is the provider name. After that they will ask the claim details and also patient details like patient, what is the patient first name last name and what is the patient date of birth, what is the patient member ID. And the claim details means what is the claim date of services and what is the claim billed amount. After that they will provide the claim status. So if you are verified this information, then insurance representative will start providing the claim status to you over the phone call. At the time you should have to ask the first question is, may I know the claim status please? For example, claim is denied, they will tell that claim is denied for pre-existing condition. For example, you already know that you found in PMS that claim is already denied on a denied UOB. We received already denied UOB from the insurance and a denied UOB telling that CO51 denial code. So yeah, CO51 is nothing but denial description also available on denied UOB, stating that non-covered due to the pre-existing condition. At the time, your question over the phone call should be like this: may I know the denied clarification, please? Because you know already denial and a denied UOB, just you want to know the clarification. What is the denial clarification? At the time, insurance representative might could be tell to you that this claim is denied like a non-covered due to pre-existing condition. At the time, you should have to ask this question: may I know the pre-existing period, please? So what is a pre-existing condition period? For example, insurance is I mean policy is new policy was taken by the subscriber June 1st of 2025, for example, and from the June 1st of 2025, the pre-existing condition will be begin and end to May 28th of 2025 or 2027, sorry, 2027. At the time, we have to understand that okay, this is approximately 3 years pre-existing period. Like that, you should have to verify over the phone call: may I know the pre-existing period, please? At the time, they will provide what is the pre-existing period, like 1 year, 2 year, or 3 year, depending upon the medical condition of that particular disease, whatever the patient having the disease before health insurance started went into effect. That is known as a pre-existing condition, right? So at the time, we should have to take the period of that pre-existing disease. So you should have to also for example, you at the time you should have to validate whatever the billed date of services is between the pre-existing period or not. For example, whatever the billed date of service is lies between the pre-existing period, at the time you should have to ask the claim number and call reference number, because the denial is correct. For example, date of service is July 1st of 2025 or July 1st of 2026, within the 1 year or within the 1 month, whatever it is. At the time insurance is denied stating that CO51, then we have to understand that denial is a correct, because the pre-existing period is started from June 1st of 2025 and our date of service is July 1st of 2025 or July 1st of 2026, whatever date of services examples. At the time, those date of services lies between the existing, I mean pre-existing periods dates. So here the denial is correct. At the time, you should have to just ask what is the claim number and call reference number, and you can close the call. For example, if the date of service is June 1st of 2028, example I'm telling 2028, if the date of service lies after the pre-existing period, then you should have to ask like this: could you please send claim back for reprocess, because the patient date of service is after the pre-existing period. So for example, your pre-existing period dates here I given is June 1st of 2025 to May 28th 2027, but our date of services is, for example, January 1st of 2028, example. At the time, we have to understand that after the pre-existing period, our DOS is lies. So our DOS is out of the existing period. At the time, you can reprocess the claim, because patient pre-existing period is done. After pre-existing condition only, we are submitted our claim to insurance. So could you please reprocess the claim? And also after reprocessing, you should have to verify what is the reprocessing period of time. Like they will take reprocessing claims period is like 30 business days or 40 business days. Once they reprocess the claim over the phone call, it will take 30 business days to get the updated claim status. Like that, you can take your claim number and call reference number and you can close the claim. So in this way, you should have to verify on-call steps for the CO51 denial. But mostly our date of service is between the pre-existing period or within the pre-existing period dates. So if the denial is true, at the time we should have to ask the claim number and call reference number, and we can close the claim. This is our on-call steps. Okay guys, now we will discuss about what are the final actions for the CO 51 denial in a medical billing. So whenever insurance is telling that we are non-covered this kind of services due to pre-existing condition, the end action on that particular claim in medical billing will be mostly bill to patient, because they are, patient know that this kind of services is not covered by the insurance till 3 years when from the policy buying date. But patient is visited, for example, within 1 year. At the time whose mistake, for example, patient visited to the doctor for the diabetes example, but diabetes is not covered by the insurance from the 3 years from policy buying date, but patient visited to doctor within the 1 year. At the time it is a patient mistake that that diagnosis is of a related to diabetes is not covered by the insurance. But however, the patient treated by the doctor and the doctor submitted the claim to insurance, and the insurance is clearly denied stating CO 51, that is nothing but patient is under the pre-existing period. That is a true. If we are verifying at the time, we can bill that claim to patient. Who is responsibility? That is a patient responsibility, because that services are not covered by the insurance during that pre-existing period. That is the first action. For example, our date of services whatever we build is out of the pre-existing period. For example, diabetes of the patient pre-existing period is, for example, it's a 1 year, for example, but our date of services is after 1 year from the policy beginning date. So at the time insurance will consider this claim as a covered, right? For example, but in incorrectly insurance is denied stating that it is a non-covered. Then we should have to probe this information by verifying the medical records, and we should have to reprocess the claim over the phone call itself. That is a well and good. It's okay. Then our action is reprocess the claim over the phone call. Then you should have to take what is the reprocessing ticket number and what is the reprocessing turnaround time. You can close the claim. That is a second action on a CO 51 denial. Third action, bill to alternate active payer. For example, our denial is true, nothing but our doses lies between the pre-existing period, and at the time insurance is clearly telling that we are non-covered. But at the time our alternate way to bill to patient, but before that we have to is there we have to verify is there any other insurance is active to be cover this kind of services. For example, there is a alternate insurance is available to the patient and which is active. At the time our option is to bill to insurance instead of patient, because in our healthcare domain we have to keep this point as a note that always we have to bill to insurance, not to the patient. If there is no insurance, there is a no source, there is a no alternate way, finally at the time we can go to bill to patient. So before that, if there any insurance is available, bill to payer, that respective payer is a good option compared to the bill to patient. So here the third action on a CO 51 denial in medical billing is bill to alternate act to covered payer. For example, our DOS is out of the pre-existing period and the denial is incorrect, and our patient services medical condition we billed after date of service only. At the time insurance representative is reprocess the claim. At the time what you will do, you have a medical records with us to prove, right? At the time we can go for appeal also on this particular denial of a CO 51, because our our services is after the pre-existing period. For example, diabetes patient has a diabetes 1 year, but 1 year pre-existing period for the diabetes, and our date of service is after 1 year. we are after the pre-existing period, but insurance we are probing this information as per the medical condition, as per the medical records to the insurance representative over the phone call. But insurance representative is refused to reprocess the claim. At the time, what we will do, we will ask the appeal details, what are the appeal mailing address, or if we are, is there any chance to send appeal through portal, or if there is any chance to send appeal through fax number. So in that way, we would like to take that appeal information, and we should have to verify what is the appeal timely filing limit. And finally, we are going for appeal the claim along with the medical records, because on the medical record they are telling that pre-existing period is, some other medical documents are there. So at the time they are telling that pre-existing documents till 1 year. After 1 year, the insurance will start paying its share to the doctors, right? Insurance will give the sharing to the will give the payments to the doctors after 1 year of the pre-existing period. That document, whatever we have, we should have to attach to the at cover letter of the particular appeal form, and we should have to submit that necessary along with the necessary documents to the insurance to prove the necessity of that medical records, so that insurance will review and give the payments if there are a valid conditions or we are proving to the insurance. Definitely we will get the payments on that particular appeal. So here the final action on a claim, if the denial is incorrect, then we can go for appeal with the correct documentation. That is the CO 51 denial action. So in that way, we should have to take appropriate actions accordingly based on the medical condition and based on the medical scenario. So this is the CO 51 scenario on this claim. Guys, if you are watching our video first time and if you not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth, and hit the bell icon so that you will get our video as a notifications to your mobile. And also, if you felt content is useful to you, could you please like our video so that it will reach us many more needy people who are looking this kind of information. And again, I am telling you, thank you so much for your time and have a good health. Bye for now.